In any favorite movie you have watched before, there's what we call behind the scene. And behind the scene are things most movie stars don't want you to know. I want to bring you back home. There are many things that happen in emergency room or healthcare settings, and those things behind the scene, many doctors, they don't want you to know about them. Why? If you get to know about them, your visit to emergency room, your visit to your primary doctor will drastically reduce. And what happens? And this messes up the business. But what happens if you neglect yourself? Simple things that you neglect before you realize you find yourself in emergency room. After emergency room, we send you bills after bills to pay. If you don't pay them, collection agency. And the collection agency, I promise you, will call you even when you are in ICU bed. They don't mind. They want to know if you have paid your bill. But I want to introduce you or just show you a simple thing or a simple assessment you can do daily at your bedside, and you will avoid frequent emergency visit. You can avoid your family member going to emergency room, and this will save you thousands and thousands of money. And I want to bring it to you. It's a simple thing. We call it blood sugar check. You might not be aware, especially those who don't work in healthcare. Your blood sugar in your blood, or the sugar in your blood, should be between 80 to 120. What happens if your blood sugar is more than 120? I'll post a clip that will give a detailed information on what happens when your blood sugar is high and probably what you should do. What if your blood sugar is less than 80? Then there are a lot of problems or issues that can happen, especially if it gets down to 60s. You can find yourself in emergency room. Emergency room in diaspora, it's very expensive. Your insurance is not going to like it. But I want to show you a quick way you can monitor your blood sugar at your bedside, at your home, as long as you have few things at your disposal. So these are the things as healthcare workers we encourage, we teach most family members or friends to have at home. You can save your life, you can save your family member, and you can save your friend's life by just doing a simple thing, and I'm going to show you, and that's blood sugar check. What do you need? You need a small machine we call a glucometer. This machine, you can find it anywhere. Retail shops, you can go to Amazon online, you can order. It's not expensive. It's less than $50, depends on where you are. But once you have this machine next to your bed, you are going to save yourself from a blood sugar crisis that can cost you thousands and thousands of money. Next you need is a blood sugar strips. This is a package which comes with it. It's very cheap to buy. It has like 100 strips in it. You can check blood sugar for 100 days. But if you are not diabetic, you don't have to check every day. If you are diabetic, you need to check it more frequent. You can check for your friends, your family member. Or you need again is your needle or the lancet. This is a small tool. It has a button, you push on it. It has a needle. You open, the needle is inside. If you see, it will poke you and it will give us a blood sample, and you're going to check your blood sugar so quick. I'm going to demonstrate to you how quick you can get your blood sugar checked and get to know what to do, so you are comfortable that wherever you're walking around, your blood sugar is fine, you have no problem. Get one of your strip. Get it out. If you see there are many in there, actually there are 100. Okay? Get your machine. Don't even turn it on. It's simple thing we do behind the scene. We bring you your blood sugar results. We do it a couple times. Then we tell you your blood sugar was high or was low. And once you call 911, this is one of the first thing we do to make sure you are not on a blood sugar crisis. Help yourself at home. So insert this into your machine. Your machine will show you when it's ready. It's waiting for you, a drip of blood from you. So the next thing, get an alcohol wipe. Pick which finger you want to check to get the blood sample from it. It's gonna feel a little painful, but not too bad. Wash your finger or clean with an alcohol wipe and dry so you don't dilute your blood. So get your needle, push hard against your skin, buck it, and squeeze harder, and you are going to get a little blood sample. That's all you need, and your machine is still waiting for you. So feed your machine with this small sample of sugar in a count of 1, 2, and 3. It's going to tell you my blood sugar is 113. So my blood sugar is between 80 and 120. So I'm happy. My blood sugar is good. I don't have to check myself again today. I am not diabetic. I can check maybe in a week or a month. But there are signs that can tell you if you need to check more frequent. Trust me, when you come to emergency room, assume your blood sugar was 500. We'll send you to ICU. And that's where we will give you drips. And my friend, once you leave the hospital, your bill is over 10,000 US dollars or millions and millions of Kenyan shillings. And we find ourselves in WhatsApp groups to fundraise and make sure we get money to get you out of ICU. Simple thing, glucometer, your lancet, your strip, and your needle, plus your finger, you check your blood sugar. Those are the secrets behind the scene. Then when you come, your patient is at the bedside, blood sugar is taken care of, but that is what we did behind the scene. Those are secrets most doctors don't want you to know, or healthcare workers. I hope that one helped you today. But if it's good, click the subscription button right down here. If you like it, click the bell. And if you see it's something you want to share with your friend, click and share with your friend. Health, or as healthcare worker, we believe that sharing is caring. May you be blessed as you take care of yourself at home, so we don't see you in emergency room or in ICU. Thank you.